E. coli is a bacteria found in the environment, food, and intestines of people and animals. Although most strains of E. coli are harmless and actually healthy, others can lead to pneumonia, urinary tract infections, respiratory illness, and diarrhea. A specific strain of E. coli that's really dangerous is called E. coli 0157H7, which produces a powerful poison called gigatoxins, and you can become very sick if it gets into your food or water. So E. coli mainly spreads through contaminated foods, but it can also pass from person to person. If you're diagnosed with a case of E. coli infection, you're considered highly contagious, and the most common ways people get E. coli is through eating raw or uncooked meat, consuming unpasteurized milk, eating contaminated foods, fruits and vegetables, and coming in contact with an infected person. So although symptoms vary from person to person, the most common symptoms of E. coli are diarrhea, stomach cramps, and vomiting. Some people get a fever, but it usually isn't high, and most people recover in from 5 to 7 days. So while some infections are mild, others can be severe or life-threatening. So E. coli was first recognized as an illness in 1982. During precipitation, E. coli can pass through and go into lakes, streams, rivers, and groundwater. And from 1982 to 2002, there were 350 outbreaks in 49 states, accounting for 8,600 infections or cases of E. coli. And in 1999, it was estimated that 73,000 people per year got an infection from E. coli 0157. And since then, the numbers and rates have been dropping, but the mortality rate is still less than 1%. So, infection rates. Oh yeah. So in May of 2019, it was estimated that about 265,000 people got E. coli infections that led to other infections, and about 100 people died. But in the next slide. In Argentina, which is the highest number of infections of E. coli 0157, the number was actually a lot higher due to cattle, because that's a main source of E. coli 0157. But little is understood because there's not much research in developing countries.
Okay, so the rates have changed and they have decreased because there's new known information that we can use to prevent cross-contamination. Some risk factors include the elderly and younger children because they have weaker immune systems. Also, people with low levels of stomach acid and get sick a lot. Treatments for this, there's no vaccine for it yet. However, they're working on it. They haven't come up with one that's for the public. Most of the treatments just include being very hydrated, don't take antibiotics, and get a lot of sleep. Methods of prevention, mostly make sure raw meats are cooked thoroughly, wash your hands before touching any raw meat or after touching raw meat. And then other methods of prevention, don't drink unpasteurized dairy products, don't eat romaine lettuce, and just make sure you wash your fruits and veggies very well. Reducing rates. So as our company, we've decided that we're gonna go to Argentina and we're gonna diminish all of the E. coli cases there currently, and also we're going to educate the people there about how it spreads and how they can prevent the spread of it in their country. One shocking statistic is the first 2 cases of E. coli, the first case, 57% of the people infected were female, and in the second case, around 80% were infected. Oh, that's so awesome.